People often refer to orthognathic surgery by various names. For these types of surgeries, maxillofacial surgery terminology is also sometimes utilized. We have two main aims in orthognathic surgery. The first goal is to aesthetically correct the skeletal deformity visible on the face from an external perspective. Another point we address is the relationship between the upper and lower teeth. In orthognathic surgery, we can fundamentally solve both aesthetic and functional problems together successfully. In orthognathic surgery, if we want to achieve a perfect result, it is mandatory for the patient to undergo orthodontic treatment and planning in every situation before the surgery. Braces treatment is what orthodontic treatment is commonly called. Before the surgery, the examinations we conduct and the measurements and drawings we make on the patient's X-ray films, that is the cephalometric analysis. As a result, we can accurately determine the skeletal deformity. After determining whether the lower jaw or the upper jaw is positioned forward or backward, we can proceed with the upper jaw, the lower jaw, or both together. We figure out how many millimeters we need to move, and we initiate our orthodontic treatment according to this surgical plan. Generally, orthodontic treatment lasts about 6 to 9 months prior to these types of surgeries. Once the teeth are prepared for surgery, we carry out these surgeries. Basically, these surgeries are conducted under general anesthesia and entirely within the mouth. If we are performing surgery on just one jaw, either the upper or lower, we should plan for an average duration of 1 to 1.5 hours. We must take that into consideration. However, if we are going to perform double jaw surgery, meaning if we need to intervene on both the upper and lower jaws simultaneously, we will have an average surgical time of 3 to 3.5 hours. The surgical time will be around 3 to 3.5 hours. Additionally, the whole surgery will take place inside the mouth. After the operation, the patient will remain in the hospital for 1 or 2 days, and we will discharge them the next day. For the first 2 or 3 days, patients need to be nourished with clear liquid food. After that, they slowly start to eat regular foods again. Typically, after single jaw surgeries, they can go back to their jobs or social activities in about a week. In double jaw surgeries, this recovery time can last up to 2 weeks on average. A frequently asked question in orthognathic surgery is, "Will my teeth be connected, doctor?" While I respect the opinions and preferences of my fellow doctors, I do not find it necessary to bond the patient's teeth after these surgeries. I don't consider it necessary and I don't do it. Thus, even right after the surgery, the patient can open and close their mouth. They will be able to speak comfortably and will be free from the social and health issues caused by bonding the teeth together. And in these surgeries, the healing process, which takes about 1 week to 10 days, will be completed after the swelling subsides and then the patient's orthognathic treatments. The orthognathic treatments should be extended for a brief period for reinforcement. If we examine the outcome in its entirety, the operation conducted completely intraorally results in an extremely rapid recovery period, and subsequently, for both, we will reach a solution with an excellent outcome both aesthetically and functionally, specifically regarding the relationship between the teeth.